Special greetings to all my listeners. I'm delighted to be back to complete the discussion on our Caesarean section that we started a while ago. Now, like I discussed at the beginning of this discussion, Caesarean section is a very common surgical procedure that is associated with a lot of misconceptions, misbeliefs, and apprehensions. So in the series that I'm starting today, I will enlighten us in easy to understand terms what cesarean section is all about and why the procedure is done. Now let me start by simplifying what cesarean section means. Cesarean section simply means the delivery of babies and product of conception through a surgical cut in the abdomen of the pregnant woman. And broadly speaking, there are two types of cesarean section in lay term language. We have the one we call elective cesarean section. We have the one that is referred to as emergency cesarean section. Elective means it is planned, meaning the pregnant woman, the doctor, the family, they are already aware ahead of time that the pregnant woman will be delivering through cesarean section. The reason for cesarean section and the timing will have been determined from the beginning of the pregnancy or in the course of the pregnancy. Whereas emergency cesarean section is referred to cesarean section that was not initially planned, but as a result of some development that put the life of the mother or the baby or both of them in danger in the course of pregnancy or in labor, made us to decide that cesarean section will be the safer route of delivery for the pregnant woman. Now, there are many reasons why cesarean section is done. These reasons are referred to as indications medically for cesarean section. And in late term language, I'm going to split them into different categories. There are indications for cesarean section that has to do with the mother, what we refer to as maternal indications. There are indications for cesarean sections that has to do with the baby, what we refer to as fetal indications. And there are those that involve both of them, medically referred to as fetal maternal indications. And in other way, for us to understand, there's another group of reasons for cesarean section that can refer to as placenta indication for cesarean section. That is, the reasons for cesarean section arises from because of issues or complications with the placenta. Now, today in this part, let's talk about maternal reasons, maternal indications for cesarean section. Now, I'm going to first mention the first one that has to do with previous surgeries on the womb, on the uterus. And the common indication in this regard is two previous cesarean sections, meaning any woman that have done cesarean section at least twice in the past must of a necessity deliver by cesarean section for the safety of the mother and the baby. And the reason simply is because once there are at least two scars on the womb of a pregnant woman, it is quite dangerous for her to try to deliver herself. There's the risk of what we call uterine rupture, which means just like a balloon. We refer to that the pregnant womb can burst in the process of labor, which put the life of the mother and the baby or babies in serious jeopardy. So for any woman who have done cesarean section twice, the safe means of delivery is to a repeat cesarean section. The other type of surgery on the womb that will necessitate a pregnant woman to be advised to go for a cesarean section include women that have done extensive fibrous surgery, what we call mammectomy. Most women who have undergone fibrous surgery, also referred to as mammectomy, especially those in whose the inner lining, what we call the endometrium, the inside cavity of the womb is entered, will always be advised to do a cesarean section. And for those that multiple fibroid nodules were removed, which means that a lot of scars were created on the womb, it is safe for the mother and the baby to undergo a cesarean section. The other type of surgery which is not so common are women who are born with congenital problem with their womb, which made them to undergo some surgery what we call metroplasty medically, that is repair of the defective womb. When such women are fortunate to conceive, it will be advised that they undergo cesarean section. Many under previous surgeries on the womb I've mentioned, those who have done cesarean section at least twice or more, those who have undergone extensive fibrous surgeries, and those who have undergone corrective surgeries on defective wombs. These three categories is always advised that they undergo cesarean section when they become pregnant. Now, other maternal reasons why a pregnant woman will be advised to undergo cesarean section include: there are some medical conditions in pregnancy, like hypertension in pregnancy, that seriously put the life of the mother and baby in jeopardy. And there are different categories. Now, the two common ones which would make a pregnant woman to be advised to have a cesarean section are severe preeclampsia and eclampsia. And I will explain what they mean. A pregnant woman is said to have preeclampsia if after 5 months, that is 20 weeks and above of pregnancy, she has elevated blood pressure and there's protein in her urine. Now, this kind of condition is regarded as preeclampsia. Now, when it becomes so bad that the BP is as high as 160/110, there's protein in the urine, and the woman is having things like headache or blood in her urine, that qualifies as severe preeclampsia. Now, if the delivery is not imminent in few hours, such a woman will be advised to undergo cesarean section for her safety and for that of the baby or babies. Now, the extreme of this hypertensive problem in pregnancy is what we regard as eclampsia. This is the extreme and the most dangerous, in which a woman that has preeclampsia, that is high blood pressure and protein in urine, already start to convulse, not because she has epilepsy or injury to her head. Now, in this instance, the cure for severe preeclampsia and eclampsia is delivery of the baby and other products of conception. So if the delivery is not imminent in few hours, such a woman will be counseled to go for a cesarean section. Now, other important indications that affect women that will make us advise them to go for cesarean section has to do with their fertility history, their reproductive history. Women who have had bad obstetric history. When we say bad obstetric history, I mean they have bad pregnancy history. Women that have several miscarriages, women that have stillborn at term at 9 months or close to 9 months. When they conceive after several losses, it is advised that they should undergo cesarean section. Now, in conclusion, under maternal indication for cesarean section, the other reasons why pregnant women will be advised to undergo cesarean section include those who have had years of infertility, 5 years and above, they've not been pregnant, and by the time they conceive, in order to minimize risk to the baby during the period of natural delivery, they are usually advised to undergo cesarean section. This is not absolute, but such women are usually counseled to undergo a cesarean section. Those women who undergo in vitro fertilization procedure with regard to IVF also fall into this category. When they conceive, it is advised they will be counseled that they should undergo cesarean section. So these almost exclusive indications for cesarean section are those that affect women with regard to our maternal indication for cesarean section. And I believe my listener will be well guided subsequently in taking safe decisions for their babies. Thank you.